Moyamoya. And here we have it written in the Chinese language, which you'll understand why here in a minute. Moyamoya sounds like a place you'd go on vacation, or some really good mixed drink you'd get while laying on the beach. Sadly, that's not at all what it is. Moyamoya is a rare disorder of blood vessels in the brain known as the internal carotid arteries. They're also known as the ICA. The condition is characterized by stenosis, which we've learned in medical terminology. Stenosis is the narrowing or blockage of one or both ICA, with subsequent formation of abnormal network of blood vessels adjacent to the ICA. The formation of blood vessels can also be described as a fine vascular network at the base of the brain. The carotid artery at the skull is blocked or narrowed, restricting the blood flow to the brain. This disease can be fatal depending on the severity, because when you're getting no blood flow to the brain, that could lead to strokes or death. It just depends. In Japanese culture, moyamoya means puff of smoke. The term describing the appearance is the tiny cluster of blood vessels. They look like a puff of smoke. So who gets this rare disease? Well, it is more common in Japan, Korea, and China. It does occur in other parts of the world, but the genetic causes affect Asian descendants mainly. There are risk factors, which if you have Down syndrome, sickle cell anemia, neurofibromatosis type 1, hyperthyroidism, and being a female and being younger under the age of 15 also is a risk factor. But for the most part, it is just a genetic cause that only affects Asians, and there isn't a really reason why that anyone has discovered yet.
You're probably already aware that the brain needs oxygen to function properly and keep us alive. The oxygen that the brain needs is supplied by cerebral arteries, which pump oxygenated blood into the cranial cavity. You can see here in this illustration a normal, healthy artery that allows blood to flow freely. This area of the artery is called the arterial lumen. Moyamoya disease causes overproduction of muscle tissue within the arterial lumen, which causes the cerebral artery to become constricted and narrow. This narrowing of the arteries is known as stenosis. This restriction of blood flow compromises the brain's oxygen supply, and it's what causes the symptoms that are associated with the disease. One of the first symptoms of Moyamoya disease is loss of neurological function, but this symptom may be so subtle that it goes unnoticed during the earlier stages of the disease. In some cases, loss of neurological function can be considered transient, which means that it comes and goes, somewhat like a light switch being turned on and off. Because Moyamoya restricts the blood and oxygen flow to the brain, stroke is one of the most common symptoms, and a lot of times it's also the first noticeable symptom that people experience. Although it commonly occurs during childhood, Moyamoya can develop at any age. Statistics have revealed two trends that indicate that it most commonly occurs between the ages of 5 and 10 years old in children, and between the ages of 30 and 50 years old in adults. The primary warning signs of Moyamoya disease are weakness on one side of the body, slurred speech, seizures, headaches, and blurry vision. These symptoms may come and go, develop gradually over time, or come on suddenly and persist. Brain hemorrhage is a very rare but potential symptom. The risk is lower for children than it is for adults, and if treated quickly, children are often able to recover after a hemorrhage. Because children under the age of 10 are usually too young to receive surgical treatment, it's important for the parents of these children to watch very closely for the warning signs of bleeding within the brain. Warning signs of a brain hemorrhage include fatigue or lethargy, severe headache, nausea, vomiting, affected vision or sudden changes in vision, and numbness in part of the body. It's important for Moyamoya patients to know these symptoms and watch for them closely. This is especially true for patients who have not received surgical treatment or for patients who are in between surgical treatments. On rare occasions, someone who doesn't have Moyamoya disease will develop a network of tiny blood vessels at the base of the brain due to underlying conditions. When this happens, it's known as quasi-Moyamoya disease because of the way that it mimics Moyamoya. Although there's no known way to prevent Moyamoya disease, that doesn't mean that prevention has nothing to do with it. Permanent neurological damage, permanent loss of neurological function, and death because of the disease may all be preventable. The best way to prevent the potentially life-threatening symptoms of this disease is to know how to recognize the signs of a stroke and act quickly when they occur. To discern if you or someone near you is experiencing the symptoms of a stroke, remember the BE-FAST acronym and go through each letter. First, balance. How is their balance? Do they appear to be off balance or are they complaining of feeling unsteady? Eyes. Ask them if they can read a line of text to you or if they can see something nearby clearly. Face. Is one side of the face drooping? Arms. Ask them if their arms or legs are feeling weak. Speech. Listen carefully to how they're talking. Ask them to repeat a sentence or two after you. Does their speech seem labored or slurred, or are they having difficulty with certain words? Time. If any of these symptoms are present, it's time to call 911 immediately. Moyamoya disease is categorized as a cerebrovascular disorder. If you break down the word cerebrovascular, cerebro means brain, vascule means blood vessels, and R means pertaining to. So the word cerebrovascular means pertaining to the brain and its blood vessels. The term cerebrovascular disorder means any disease, disorder, or condition that affects the arteries and/or blood vessels that supply blood to the brain, thus compromising the brain's oxygen supply. The process of diagnosing a cerebrovascular disorder is rarely straightforward or simple. There are so many variables that go into the diagnosis of a cerebrovascular disorder that it becomes very complicated. However, thanks to diagnostic imaging, it is possible. If we didn't have diagnostic imaging, diagnosing cerebrovascular disorders would be impossible. Magnetic resonance imaging, which is more commonly known as an MRI, is one method that's often used to diagnose cerebrovascular disorders. Unlike most medical imaging methods, an MRI machine doesn't use radiation to create an image. Instead, MRIs use a combination of a strong magnetic field and radio frequency waves to produce a detailed view of the soft tissues of the brain. A magnetic resonance angiogram, or MRA, is a procedure that's done during an MRI. When an MRA is done, a non-toxic dye is injected into the bloodstream to make the arteries and blood vessels more visible, and this also highlights the amount of blood flow within the brain. The two pictures on the right are MRA images. The image on the top shows the arteries and blood vessels in a normal, healthy brain. The large artery that's labeled ICA is the internal carotid artery. In this image, you can also clearly see the anterior cerebral artery, which is labeled ACA, and the middle cerebral artery, which is labeled MCA. In the image on the bottom, you can see how the anterior cerebral artery and the middle cerebral artery are no longer visible. And this is because there's stenosis in the internal carotid artery that's blocking the flow of blood to those areas of the brain. The portion of the image that's circled shows the development of a network of tiny blood vessels, which is indicative to Moyamoya disease. Computerized tomography, which is better known as a CT scan, is another method that's often used to diagnose cerebrovascular disorders. Because of the extreme detail that can be achieved from a CT scan, many physicians prefer to use a CT scanner over an MRI when it's available. You can think of a CT scanner as a rotating X-ray machine. When a traditional X-ray is done, the X-ray machine is used like a big camera that takes a single image of one spot on the body at a time. A CT scanner, on the other hand, rotates in a circle around the body as the patient moves slowly forward through the machine on a motorized platform. This motion allows the fan-shaped X-ray beam to move around the body in a very tight spiral. Each rotation creates an image that's like a thin cross-section of the body. When the scan's done, those images can be viewed individually, or they can be viewed all together to create a 3D image. Most up-to-date CT scanning equipment is now programmed to perform CT perfusion scans in addition to traditional computerized tomography. A CT perfusion scan allows physicians to see detailed information about the blood flow in the brain and to identify which areas have poor blood flow if there are any. This capability can be a very big advantage when diagnosing cerebrovascular disorders. MRI and CT scanning have become standard first choices for the initial testing of cerebrovascular diseases because they're non-invasive and reliable, and the necessary equipment to do them is available at most hospitals and medical centers that treat neurological conditions. If you look at the image here on the right, you can see an example of an MRI scan that's shown signs of Moyamoya disease on one side of the brain. This is known as a unilateral diagnosis, and when it shows up on an MRI or a CT scan, then a cerebral catheter angiogram is necessary to confirm the diagnosis. A cerebral catheter angiogram is an invasive procedure that uses X-ray imaging and injected dye to make the arteries and veins of the brain more clearly visible. The dye is injected using a catheter that is gently progressed through the bloodstream to the base of the brain, where it then releases the dye prior to imaging. Catheter angiograms are required to confirm the diagnosis of unilateral Moyamoya disease. They're also used to identify potential underlying conditions or complications that are suspected. This procedure is usually done both prior to and after surgical treatment. The two primary forms of treatment for Moyamoya disease are medication and surgery. Antiplatelet medication controls symptoms and slows the overall decline of cerebrovascular health. Arterial bypass surgery forms a new blood supply to the affected parts of the brain. Although surgery is the preferred method of treatment, drug therapy may be used in addition to surgical treatment. For patients who are unable to receive surgical treatment, medication is considered the best alternative. Because of the extreme rarity of the disease, there is a limited amount of accurate information regarding the prognosis of patients who receive drug therapy alone. Recorded cases suggest that it may be possible to prevent a rapid decline in condition with medication. However, in most cases, these patients were unable to maintain a stable condition for more than 6 to 10 years.
Moyamoya is not something talked about in class. It's usually not something that you've ever actually heard of. It's a very rare disease, a disease that hits a little different when your family member's diagnosed with it. My uncle Chad Plemons had a stroke in September, and on November 18th, they finally diagnosed him with a disease called Moyamoya. My uncle is from Hayesville, North Carolina. It's crazy to think that in the mountains of western North Carolina, that someone is diagnosed with a rare disease that only affects people of the Asian heritage. My uncle is Caucasian. He's never traveled out of the country, nor does he have any risk factors of the disease, such as sickle cell anemia, Down syndrome, and he also has no risk factors that would deem him susceptible to the Moyamoya disease. Chad is one of less than 200,000 people in the United States with this disease, and the disease cause is unknown at this point. Chad's treatment took the route of surgery. On December 4th, 2019, him and his family traveled to Raleigh and met with a doctor named Dr. Fukushima. Him and his assistant were very thorough in explaining the Moyamoya disease and all the specific details that related to my uncle. Based on the reports of scans, Dr. Fukushima was willing to do the cerebral bypass on the right side of the brain at first. The stroke that occurred in September was the result of weakened vascularization on the side, and there was still a very small aneurysm on the right side as well. Of course, it hasn't ruptured yet. During the surgery, they took out his temporal artery, which provides blood supply to his face and scalp, and they rerouted it into the front part of his brain through a craniotomy above his right ear, which is shown in the picture. The surgery took place the first week of February at Wake Medical Center. It took 12 hours long to complete, and after this, there was a 5-day hospital stay to follow up. Once he was released to come home, he was made to do 4 weeks of recovery time, which isn't a lot for somebody who just had brain surgery. At this point, there are no immediate concerns of threats on the left side. The surgery will mimic the first one, but it'll just be on the left side of the brain. Although the timeline is a little longer than the family anticipated, they are totally confident in Dr. Fukushima and his expertise. Dr. Fukushima has done 300 of these surgeries, if not more, and there is a less than 1% risk of complications underneath his care. Dr. Fukushima has performed 24,000 neurosurgical cases so far. Among the 24,000 patients, 16,000 cases are skull base neurosurgical surgeries, which is a world record, 2,200 aneurysm cases, and 10,000 cases of skull-base brain tumors. Not many doctors can say they do that. His motto is one surgery and full recovery. I try my best for every patient so they can have the best outcome as possible. He honestly was God-given at this point for my family.
Because there are so few Americans that are diagnosed with Moyamoya disease, it could be argued that patient education on the subject is only relevant to the small number of individuals who have been diagnosed with it. However, cerebrovascular disease affects thousands of Americans each year, and awareness of these conditions is more important than most people realize. The chances of being diagnosed with Moyamoya disease in the U.S. may be extremely low, but an understanding of the associated warning signs may mean the difference between life and death. Although Moyamoya disease is a very serious cerebrovascular disorder with the potential to be deadly, many patients, like Chad, who are given a prompt and accurate diagnosis, stand a good chance of living a normal, healthy life. Thanks to modern diagnostic imaging methods, Moyamoya disease is rarely overlooked or misdiagnosed, despite its extreme rarity. Furthermore, the surgical methods used as the primary treatment for the disease have a high success rate, and these methods typically result in reversal of the effects of the disease. The cause of Moyamoya disease remains a mystery, but research continues, and each new discovery helps improve the chances of survival for Moyamoya patients. Because of its extreme rarity, there are no local community resources specifically for patients with Moyamoya disease. However, there are some resources available for patients with rare diseases in general. And thanks to modern technology, online communities have become an integral part of our society. Online support groups and networks can't replace human interaction, but they can offer valuable support when local resources are scarce or unavailable.
Questions, comments, concerns?